Today we are going to see about cavernous sinus. So what is cavernous sinus? It is one of the intracranial dural venous sinuses. Totally there are 21 venous sinuses, among which 7 are paired and 7 are unpaired. The cavernous sinus is one among the 7 paired. So first we will know about intracranial dural venous sinuses. It lies between the layers of dura mater. There is no muscle in their wall. They are devoid of valves in their lumen and they receive venous blood and CSF. So now we will see the location of the cavernous sinus. Cavernous sinus is a large venous space which is situated on either side of the body of the sphenoid and sella turcica in the middle cranial fossa. Its interior is divided into number of small spaces called caverns by trabeculae. Next, the floor of the sinus is formed by the endosteal layer. Its lateral wall, medial wall, roof are formed by the meningeal layer. Posteriorly, the roof has a triangular depression through which the oculomotor and trochlear nerves enter the cavernous sinus. First, to remember the diagram of the cavernous sinus and its relations and contents, I'm going to compare it with the face of a man. So, see here, a man has a nose and he has a mustache. Okay, and remember he has 2 teeth. Okay, then draw a lower lip. He has 2 eyebrows and 2 eyes. Okay, this is what you have to remember the diagram of cavernous sinus. So, how we are going to draw the cavernous sinus diagram? So for cavernous sinus, first we are going to draw the nose, right? So for nose, draw a funnel shaped diagram. Okay. Then we are going to draw a mustache. Remember, draw something like this. Have drawn the mustache. Then I have told you there are 2 teeth for that man. So draw 2 teeth, and I have told you to draw a lower lip, right? So this is the lower lip. Then 2 eyes I told you. So instead of eyes, draw 2 tubes here. And I have told you he has eyebrows. So for that, draw an arch-like structure. Okay. Then fill the mustache inside. Length. Okay. Then fill it with dotted spaces. And then we are going to draw 4 nerves. Okay, so remember, mark in order 1, 2, 3, 4. Then 1, 2, 3, 4. Then here one artery, here one artery, here one nerve, here one nerve. Then a nerve here and here. Okay. Now we will see the relations of the cavernous sinus. So superiorly it is related to optic chiasma, optic tract, internal carotid artery and anterior perforated substance. Inferiorly it is related to the foramen lacerum and junction of body and the greater wing of sphenoid. Medially it is related to the pituitary gland and sphenoid air sinus. Laterally, if you see, it is related to the temporal lobe of the cerebral hemisphere and cavum trigeminal. Anteriorly, it is related to the superior orbital fissure and apex of the orbit. Posteriorly, related to the crus cerebri of the midbrain. So, the structures present in the lateral wall of the sinuses are, I told you, 4 nerves, right? They are oculomotor, trochlear, ophthalmic, and maxillary nerve. Internal carotid artery and abducer nerve pass through the cavernous sinus. Tributaries of cavernous sinus. The cavernous sinus receives blood from orbit, meninges and brain. From orbit, it receives blood from ophthalmic vein, that is superior and inferior. From meninges, it receives from the sphenoparietal sinus. Then from brain, through the cerebral vein, that is superficial middle cerebral vein and inferior cerebral vein. Now the tributaries of communication of cavernous sinus, there is a diagram. Remember, we are going to draw a spider, okay? This is a spider body. How much legs the spider has? It has 8 legs, right? So remember, you're going to draw 8. 1, 2, 3, 4, 5, 6, and we're going to join these two. Then this one will be your 7. And this one will be your 8. Okay, then double everything. Doubling is like this. Double every lines. Doubling, right? Then close this. So what does the spider do? The spider spins web. So join these two and draw structure like webs. Okay. Then from there, draw something like this. And the spider has hair, right? So draw hair-like structures. Okay. Then here, these are all wings. This is for foramens. Okay. So this is the proper diagram for tributaries and communications of cavernous sinus. You can see the transverse sinus, superior and inferior pitotal sinus, emissary veins, superior sagittal sinus, and basilar venous plexus.